Okay, so now, good afternoon, everybody. We are going to start our class, especially based on the dental pharmacology, dental pharma. So, you will face so many terms in concern with the dental pharmacology. So, today we are going to see all this. Just we are waiting for the latecomers. They are still in need of permission to enter. So, let's start. Today we are going to see the dental pharma, the special dental medical pharmacology you have seen. Now we are in concern with the problems that we face in the dentistry and how to manage these problems. So as you are all the dental students and you know it very well that what is dentistry? Dentistry is in concern with the prophylaxis and treatment of the diseases and disorder of the teeth, gums and oral cavity. So that is the dentistry. So you have to deal with the disorder of the teeth, gums, that is periodontium and oral cavity. About the anatomy of teeth, etc., that you know it very well. Now the two major dental problems that you will face is the dental caries. One is the dental caries, another is the periodontal diseases. Periodontal diseases, that is the cementum, periodontal structure consists of cementum, alveolar bone, periodontal ligament and gum or gingiva. The common responsible component for both of these dental problems, so the major dental problem are dental caries and periodontal disease. The common responsible component is the microbial plaque. So plaque, that is the component responsible for both of these problems. What is plaque? A sticky film of bacteria covering the teeth is plaque. So plaque, nothing but a film of bacteria that sticks with the teeth. That is plaque. What is the problem with this plaque? If it is not removed with thorough daily brushing and cleaning, it gets hardens to form calculus or tartar. So plaque, if not properly removed, that get hardened to form a calculus, which is also known as tartar. So we face the two major dental problems, dental caries, periodontal disease, and the common reason for this problem is the plaque, microbial plaque. That is the common reason for this problem. So let us see first the dental plaque. So dental plaque that causes erythema and gingival bleeding, that is also referred as gingivitis. Why this occur? The bacteria, the film of bacteria that is covering this, that release the acid and that attacks the tooth enamel. So tooth enamel that is attacked by the acid released by this bacteria. The repeated attacks may break the enamel, leading to cavities, and the most powerful protective natural barrier, as we all know, that is the saliva. The role of saliva is to clean, to strengthen the teeth, to protect against the bacteria, maintains the pH, to prevent the foul smell and promotes the mouth functions and comfort. So they are the role, that is the physiological role of saliva, and that is the best protective measure against dental plaque. So let us see firstly the common disorder that you may face during your practice, that is xerostomia. Xerostomia means dry mouth, the reduction of salivary secretions that is leading to dry mouth, that is xerostomia. It may occur because of some temporary reasons or some long-term causes. So temporary causes are the mouth breathing, the persons who breathe with the mouth breathing. Patients with the depression, stress, anxiety, hypertension, smoking, hormones, and drugs. Many drugs, for example, the anticholinergic drugs and all other drugs which are having anticholinergic component like antihistaminics, antidepressants, antipsychotic, clonidine, and diuretics. Diuretics by producing dryness, that is. Then these are the temporary causes. The long-term causes are the Sjogren's syndrome, SLE, that is systemic lupus erythematosus, diabetes, Raynaud's disease, Parkinsonism, radiotherapy, head and neck surgery, HIV, that is leading to the AIDS, primary biliary cirrhosis, and cystic fibrosis. So they are the problems responsible for the long-term production of the xerostomia, and they can produce the serious problems. So let us see how to manage this problem. What are the drugs, etc., which we are using for this xerostomia? So treatment of xerostomia: frequent sips of cold drinks. That is the one measure that can correct so many cases of xerostomia. Then another is the sucking pieces of ice sucking, that can also sugar-free chewing gum, that also temporarily enhance the salivation. Saliva substitute, which are used as medicine. Saliva substitute, that is also known as artificial saliva. They are nothing but viscosity enhancing agents. They enhance the viscosity. For example, gastric mucin, carmylose, and electrolytes including fluoride. So by enhancing the viscosity, they are acting as the substitute for the saliva. That is there. Then a drug that is well known to you, that is the cholinergic drug pilocarpine. The oral tablets of this pilocarpine, they are well effective in enhancing, in promoting the salivation. If the salivary glands are still functioning, they can increase the release, increase the salivation. They are also promoting other secretions. So sweating is the major adverse effects. A lot of sweats, that is the problem with the pilocarpine in association with the salivation. So we need a selective drug and a new introduction of a selective cholinergic agent, that is M3 agonist, muscarinic 3 receptor agonist. The drug is cevimeline. So cevimeline, that is a new drug that is selectively promoting the production of salivation, and so that is the new drug for the management of xerostomia. The old drug is pilocarpine. So old drug pilocarpine, new drug is cevimeline. Now coming to some other category of the drugs which are used in the dental practice. So we have discussed the dental plaque. They are responsible for this common dental problem. So we need some diagnostic agents. They are referred as disclosing agents. Disclosing agents are used to disclose or to reveal the dental plaque. How to diagnose them, how to reveal them, how to disclose that there is a plaque. So they are used for this purpose. The basic function they are performing is that they color the plaque and then the plaque becomes visible to us. So if they color the plaque, it becomes visible to us. So various agents are used for this purpose. These agents are erythrocene. Erythrocene that produces red staining. Then the sodium fluorescein that produces bright yellow fluorescence. Then nowadays the two-tone solutions are also available. Two-tone solutions, they stain the old plaque as blue and new plaque as red. So we are able to differentiate the old plaque whether it is old or newer by the two-tone solution that stains the old plaque as blue and new as red. So that is also disclosing agent. Then coming to the anti-plaque. So we have diagnosed the plaque. Now coming to manage, how to manage this, how to prevent, how to treat, that is. So the most commonly used agent as anti-plaque is chlorhexidine. Chlorhexidine, what does it do? It binds to hydroxyapatite and bacteria and it gets released slowly. What is the role of this hydroxyapatite? We are dekhenge thodi der mein. So binds to hydroxyapatite and bacteria also, and it gets released slowly. It damages the permeability barriers and disrupts cell membrane of bacteria. So bacteria mein bind ho gayi, that is released slowly, damages permeability barriers, disrupts the cell membrane of bacteria. So cell membrane of bacteria is disturbed. So the bacteria ultimately will die. The limitation of this drug is that the effect terminates within 48 hours of stoppage. So within 48 hours of stoppage, the effect terminates. There is a poor activity on subgingival plaque. The plaque that is residing below the gum margin, so that is poor activity. Then the excess use of chlorhexidine, that it can lead to some adverse effects. There may be unpleasant taste, brown staining of teeth, and delayed wound healing. Anybody can answer that which antibiotic produces yellowish brown discoloration of the teeth? आपके माइक चालू है. Rifampicin? No. Brown, yellowish brown discoloration of the teeth. Which antibiotic? Rifampicin से red orange discoloration होता है, पर teeth का विशेष नहीं होता. Teeth में deposit नहीं होती. बाकी जगह secretion होता है red orange. So which antibiotic gets deposited in the teeth and produces yellowish brownish discoloration? This antibiotic is contraindicated to a child. 12 साल के पहले हम use नहीं करते हैं. इसी purpose. Bones में भी deposit होता है, that retards the bony growth. कौन सा है?
चिलेट डिपोजिशन
कौन सा
होता है? डॉक्सीसिलिन, टेट्रासाइक्लिन.
Tetracycline, yes, good. That is the antibiotic. Tetracycline, that produces yellowish brownish discoloration of the tail. So one thing that should be very clear to you as dental students, मेडिकल ड्रग्स जो ड्रग्स है जो उनका डेंटल इम्प्लीकेशंस क्या है, क्या डेंटल प्रॉब्लम होते हैं उनसे, क्या दैट इज मोर इम्पोर्टेंट फॉर यू कि डेंटल प्रैक्टिस में क्या इनकाउंटर है, तो वहां फोकस करें, वहां ध्यान देके उसको पढ़ें. ओके, एनीवे, chlorhexidine that can also produce brown staining of the teeth. It can delay the wound healing. It also promotes supragingival calculus formation. That is another drawback that can also. So regular use, we cannot advise to that everybody should use chlorhexidine daily, routinely. That is not enough. So what are the therapeutic indications where we indicate this drug? The therapeutic indications are as preventive mouthwash. माउथ वॉश के रूप में जहाँ ओरल हाइजीन पुअर है, जहाँ हमें प्रॉब्लम हो रहा है, तो वहाँ यूज करते हैं. As disinfections, to produce disinfections of the oral cavity before dentine treatment. जब भी आप कोई dentine therapy that is you are using, so for the disinfections of the oral cavity, and for aphthous ulcer and denture stomatitis. एप्थस अल्सर एंड चेस्ट में पहले हम पढ़ चुके हैं एनारोबिक इन्फेक्शन जब पढ़ा था. So for that purpose they are indicated. Then beside chlorhexidine there are various other anti-plaque agents such as delmopinol. Delmopinol prevents the adherence of plaque bacteria, that the bacteria will not adhere, so prevent that. Then another one is triclosan. It produces membrane leakage and lysis of bacterial cell, triclosan. To this triclosan, we incorporate a copolymer. The purpose is that it enhances the substantivity. In dental practice, you will often listen this term, substantivity. Substantivity means the period of contact with oral cavity. So the period, total period of contact with oral cavity of this triclosan gets enhanced, increased because of the incorporation of a copolymer. So that enhances this. Then another one that is used is the Listerine, which is a mixture of essential oils, thymol, eucalyptol, methyl salicylate, and menthol in alcohol-based vehicle. So essential oils, various essential oils mixtures, that is Listerine. It inhibits bacterial enzymes, reduces pathogenicity of the plaque. The drawback is that it produces bitter taste and burning sensations. Bitter taste and burning sensation, that is. Otherwise, that is also one of the commonly used agent, Listerine. Then various enzymes can be used, for example, trypsin, chymotrypsin, amylase, lipase, nuclease, etc. But though they break down the plaque matrix and disperse the microorganism, but they are having a poor efficacy. So poor efficacy, that is the problem with this. Then there are pre-brushing rinses, which are claimed to loosen the plaque. For example, sodium lauryl sulfate that acts as a detergent to dislodge or loosen the plaque. So there are various other anti-plaque agents. Besides this, some oxygenating agents are also used as anti-plaque. Oxygenating agents means oxygen releasing. They are releasing oxygen. So they release molecular oxygen and can reduce the plaque formation and gingivitis. Hydrogen peroxide, which is one of the commonly used oxygenating agent in the dental practice, hydrogen peroxide that is used as antiplatelet, but the frequently if it is used, there is risk of oral ulceration. So limited time use that is indicated. Another one is the carbamide peroxide, 10%, or sodium perborate. So they all are oxygenating agents which are used as anti-plaque drugs. Then one term that is used is photodisinfection. Photodisinfection. So that is the short form of this photodynamic disinfection. Photodynamic disinfection is the use of a photosensitive compound. Photo means light. So photosensitive compound to destroy the microorganism within periodontal pocket. So in the periodontal pocket, it will destroy the microorganism. So methylene blue that is added to the subgingival biofilm that binds to the periodontal pathogens. So after using this methylene blue, a non-thermal diode is used to sensitize the methylene blue for killing of the pathogen. So that is the photo disinfection. So non-thermal diode that is used in presence of methylene blue, and that will ये आता है प्रॉब्लम जूम में, फिर वो आ गया कि वो अपग्रेड करें इसके चार्जेस, और थोड़ी देर बाद जूम में प्रॉब्लम होता है इतने चार्जेस। है 30 मिनट में कर देता हूँ, तो आधी घंटा हो गया होगा ना, अभी इसको वापस से कर लो, उसको वापस से बंद कर, नहीं 5-1 मिनट पहले फिर तो हो जाएगा, 5 1 मिनट, इसको बंद कर, नहीं फिर से हो जाएगा ना, अपडेट हो जाएगा तो फिर से चलो। आपके पास ही क्यों आता है अपडेट करने में? देखो आता है ना, है ना, नहीं हमारे पास नहीं है, हमारे पास ऑटोमेटिक बंद हो जाती है, बंद हो रही, बंद नहीं हो रही, चालू चालू हो जाएगी फिर अभी वापस। हमारे पास तो ऑटोमेटिक 40 मिनट बाद बिना किसी उसके बंद हो जाती है, ये वापस हो गई चालू। So photo disinfection that we have covered. Now the next one are the anti-caries agent. The dental caries that is characterized by progressive decalcification of the tooth structure. So progressive decalcification of tooth structure that will lead to the caries. This is caused by interaction between bacteria, diet and tooth surface. So between bacteria, diet and tooth surface, the interaction that is leading to the caries. These bacteria which are producing acid, especially acid producing bacteria, breaks the carbohydrate to produce acid, and this acid demineralizes the enamel surface. So that is the progressive demineralization, decalcification of the tooth structure, that is known as dental caries. The bacteria commonly responsible is the Streptococcus mutant. So Streptococcus mutant is the main organism that is producing lactic acid, that is producing this damage, etc., and that is responsible for the caries. So let us talk something about anti-caries drugs. So fluoride, that is the main in this group. Fluoride reduces the risk of caries. See how it reduces. It promotes the formation of fluoroapatite from hydroxyapatite. अभी हमने बात की थी ना hydroxyapatite. So it converts this hydroxyapatite to fluoroapatite. What is hydroxyapatite? It is the mineral component of enamel that easily dissolve in acid. जब bacteria acid produce करेंगे, they will dissolve the hydroxyapatite, which is the mineral component. So there will be demineralization. So fluoride is converting hydroxyapatite to fluoroapatite. So that is the easily soluble form is converted to a less soluble form, and therefore it reduces the risk of plaque formation. Also, it inhibits some enzyme functions, and therefore that is producing this response. The fluoride that is used systemically as well as topically, the various types of solution, fluorine solutions, the aqueous solution of sodium, or more effective one is stannous fluoride, that is commonly used, stannous fluoride. The drawback is that it is unstable and it stains the teeth. Acidulated phosphate fluoride is another. Sodium monofluorophosphate, which is often used in toothpaste, sodium monofluorophosphate. So they are the various fluoride preparations used to reduce the risk of caries. Then again, every medicine is having its own adverse effects. So adverse effects of fluoride, excess use of the fluoride can lead to skeletal fluorosis. Skeletal fluorosis, there is increase in the bone density, increased thickness of the long bone, and calcification of the ligament and fractures. So the increased risk of the fractures, calcium of ligaments, bone density, etc., that is because of the excess use of the fluoride, that is known as skeletal fluorosis. Another one is the dental fluorosis. Dental fluorosis, where white patches in enamel they are occurring, and they can there could be the severe hypoplasia of the teeth. That could be the problem. Then excess oral ingestion, oral intake of the fluoride in excess, that can produce gastrointestinal irritation and erosion, since it is converted to the hydrofluoric acid in the stomach in presence of gastric acid, converted to hydrofluoric acid, which can lead to gastrointestinal irritation and erosion. If toxicity occurs with the fluoride, how to manage? The treatment of toxicity is by milk, calcium carbonate, milk of magnesia, they are slowing the absorption. So they slow the absorption, and therefore that is effective in the managing the fluoride toxicity. Now let us talk something about the desensitizing agents. मीटिंग हमारा टाइम बंद हो जाएगा जूम में, शायद हम यहाँ रुक जाएंगे, इसके बाद अगली क्लास में देखेंगे। अभी डिसेंसिटाइजिंग एजेंट्स का थोड़ा सा देखें अगर टाइम परमिट हुआ तो। So desensitizing agents, obtundants, they reduce sensations by obliterating the irritations. So desensitization, that is inhibited. They are obliterating the irritation. So they are also known as obtundants. So short notes of exam are the obtundants, yeah, desensitizing agents. So you must be familiar. Obtundant, that is same. Various agents are there which can be used as desensitizing agents, and based on their mechanism of action, we can categorize them into agents that obliterate dental tubules. So there are some agents which obliterate the dental tubules by precipitating the protein. The precipitation of the superficial layer of the protein, this process known as astringent effect. That is astringent effect. So they are the astringents, they precipitate protein. Zinc chloride is one example. The zinc chloride, the advantage is that it does not stain the teeth. Another is silver nitrate. The problem is that it stains the teeth black. That is there. Then others which can be used as astringent, they are paraform and formaldehyde. The paraform releases paraldehyde that precipitates the protein in the dentin tubules and reduces the sensitivity. Yes, some problem, Stuti? Is there any problem, Stuti?
No, sir.
हाँ, you raise the hand, ऐसा मैसेज आया, इसमें कुछ प्रॉब्लम सुनाई दे रहा है ना सबको? क्लियर है, दिखाई दे रहा है,
Yes,
सुनाई दे
sir.
रहा है? Okay.
Yes, sir.
So silver nitrate, paraform, formaldehyde, etc., they are precipitating the proteins there. Then there are some agents which seal off, which produces sealing effect in the orifices of the dentin tubules. कुछ आपके साथी लोग अभी भी क्लास में एंट्री के परमिशन मांग रहे हैं, क्लास खत्म होने वाली है। Anyway, so sealing of the orifices of dentin tubules, thus forming a mechanical barrier. For this purpose, we are using Tresilon, strontium chloride, the various oxalates, varnishes, the bonding resins and dentine adhesives which flow in the dentine tubules to seal the dentin surface. They are also used. Chloride is also performing the function of desensitizing agent. Sodium chloride, stannous chloride, sodium monochlorophosphate, they block the dentine tubules through the fluoride precipitation. They get precipitated, block the tubules, and therefore they are acting as desensitizing agent. So first category, the agents that obliterate dental tubules. Here subcategories are by precipitating the proteins, by sealing off the orifices, that is there. Then the next category of the obtundants or desensitizing agents are the agents which reduce the then there are the drugs which stimulates the sensory nerves to desensitize them. You might be familiar with this term, that